Hello, my name is Professor Lauren Sherar and I work at Loughborough University. I've been asked by Teach Active to do a short presentation on the evidence linking physically active lessons with children's physical activity, learning and also health. So as I'm sure you're all aware, physical activity has a host of benefits for children and young people. This can include physical health benefits such as improved body composition, stronger muscles and bones, and also enhanced cardiorespiratory fitness. We even see improvements in other indicators such as improved glucose control and cholesterol. In addition to these physical health benefits, we also see improvements in mental well-being. So children that are physically active tend to be able to deal with stress better and have reduced anxiety and depression. And this can lead to kind of social well-being, which with improvements in confidence and peer acceptance of children that are more physically active. And a reason why we really think about children at childhood as being a critical period is that we know that physical inactivity does track into adulthood. So if we can get children to be more physically active, they are more likely to be physically active adults and then reap the benefits throughout the rest of their lives. So in addition to these kind of physical, mental and social well-being, we also now know that physical activity might also be related to academic achievement and also cognition. And one of the seminal studies in this area was published by Charles Hillman from the United States, and I'm going to share with you some of those preliminary findings. So this was a small experimental study where he recruited 29-year-old children. And what he did was he asked the children to complete some standardized tests, so in reading comprehension, spelling, and also arithmetic, after the children had been seated for 20 minutes, so inactive, and after they'd been walking for 20 minutes. And what he found was that there was a significant improvement in all of these standardized test results after the children had been walking for 20 minutes. So this was really one of the first studies to show that this was an effect in children and young people. But what it didn't do was tell us why or how. So in this same study, he also asked the children to complete a cognitive test. And the cognitive test is quite a usual one that we see in the literature called the flanker test. So what this test does is it asks children to press a button fairly quickly to indicate in what direction an arrow is showing, like I'm showing you on the screen right now. Now, the fairly easy condition is the congruent condition where all the arrows are pointing in one direction. However, the slightly harder condition is the incongruent condition where some of these arrows are actually pointing in a different direction. So what he did was he asked these children to complete this cognitive test after they had been seated or walking for 20 minutes. But in addition, he also got them to wear this very smart hat here, which has electrodes around the brain. So what we see here is after rest, so when the children have been sitting for 20 minutes, what we see is that there's increased brain activation in the incongruent tests compared to the congruent test. This is what we would expect. But interestingly, after the children had been exercising for 20 minutes, we saw even more brain activation in both of these different conditions. So this really did suggest that there was a physiological mechanism here which was increasing blood flow to the brain, which was causing potentially an increase in brain activation, which we then believe might have led to the increased standardized test results that we saw on the previous slide. So this is really a summary slide which shows that we do know that while there are lots of other factors playing into academic success, such as IQ, quality of the education in the schools, and also how much a child does homework, for example, we do know that there's these number of these other mechanisms which might link physical activity to improve test results among children and young people. So if we had a multivitamin out there that had all of these benefits from physical, mental, social, and now potentially cognitive, then we would be prescribing this to all of our children. But unfortunately, when we look at the dose of physical activity that children are getting, it's actually quite low. So this is some results from our National Health Survey here in the UK, which suggests that only 23% of our boys aged 5 to 15 and 20% of our girls are reaching the minimum levels of physical activity that they are required for health benefits. So this means that a large portion of our children and young people are in fact inactive. And this and some of the rising rates in childhood obesity led our government to produce this report, so the Childhood Obesity, A Plan for Action, where they actually asked schools to help children accrue at least 30 minutes of physical activity per day. This is about half of the recommended daily physical activity that children should be doing. Now, they recognise that it's very hard for schools to do this, and they said that one of the reasons, or one of the ways that schools can actually accrue this 30 minutes of physical activity could be through active lessons. So what are active lessons? Active lessons can be anything from short breaks of physical activity, maybe 2 to 5 minutes, where there's no content being taught. These are often called energizer breaks, or just these little breaks that means that a child can actually reset and concentrate back on task. But this can go all the way through to, for example, whole lessons that can be taught through physical activity rather than the more traditional seated, where children most often are learning. And so you see some of these examples in Teach Active, where they're teaching maths and English through physical activity. So what does the evidence suggest around the links between physically active lessons and improvements in learning? So we do know through really big systematic reviews of the literature that physically active lessons lead to greater on-time task, which means they pay greater attention to the educational content delivered. So we've got quite a lot of literature to suggest that this actually happens. But in addition to that, there's lots of individual studies which suggest a number of different improvements in different realms of academic achievement, learning and cognition. So for example, there has been a study that showed that active lessons can result in a reduction in distraction of children, but also improvements in activation and arousal. So this led Loughborough University to do some research with Teach Active around their programmes. And what we did, I think, was quite a neat study where we went into a Teach Active school and we documented objectively, using a physical activity monitor that you can see in the top right hand corner, the physical activity of children on a day where they were doing Teach Active lessons, and then compared it to a day where they were not doing Teach Active lessons, so the more traditional lessons. In addition to monitoring the physical activity of the children, we also looked at their positive affect, their emotions. We looked to see how they were feeling before, during and after a seated lesson versus a Teach Active lesson. And what we found was that actually through a Teach Active lessons that 33% of the government daily physical activity targets could be reached. So this is really kind of positive to show that if schools are trying to reach these 30 minutes of physical activity per day of their children, physically active lessons such as Teach Active lessons are a really great way of doing this. But also, interestingly, significantly more children reported feeling happy immediately after a Teach Active lessons compared to a seated lesson. So that's the end of my very short presentation. So just to kind of summarise, I hope through this presentation you've seen that physical activity has a host of benefits for children and young people. And while we see that lots of young people are not physically active, schools can be an important setting to help children meet their physical activity targets or recommendations. There is a lot of evidence, including some evidence and some research that we've done in Teach Active schools, to suggest that physically active lessons may enhance academic achievement via several mechanisms. So that's it for today, but I hope you've enjoyed this very short presentation. Take care.